Hello and welcome to Health Professional Radio. Nearly two-thirds of baby boomer nurses are considering retiring, leaving the workforce, even as more people require more and more nurses. The demand for RNs is rising rapidly, even as 62% of nurses over the age of 54 are considering retirement sometime within the next 3 years or so. Our guest in studio today is Dr. Marcia Faller, PhD and RN, and also Chief Clinical Officer for AMN Healthcare. Her background is in critical care nursing, earned a Bachelor of Science degree in nursing from the University of Arizona, as well as a Master of Science in nursing and doctorate in nursing from the University of San Diego. And Dr. Faller is also on the board of directors for the Alliance for Ethical International Recruitment Practices and on the Joint Commission Advisory Board for the Healthcare Staffing Services Certification Program. She's here today to give us a little bit about her background and what led her to become so passionate about offering staffing solutions in the healthcare industry. How are you doing today, Dr. Faller?
I'm doing very well, Neal. Thank you.
As the Chief Clinical Officer for AMN Healthcare, could you briefly tell our listeners exactly what it is that AMN does?
So AMN is a healthcare staffing and workforce solutions organization. We're the nation's leading company in this industry. We provide healthcare professionals to the largest and most prestigious healthcare providers across the country, both for contingent and permanent staff. We also provide advanced workforce management programs, which we call workforce solutions. These include managed services programs, which take care of all administrative, recruiting, and credentialing responsibilities for part or all of the facility's workforce. And we offer technology-enabled systems for managing your workforce. We also have a new offering in predictive analytics that can actually forecast a healthcare provider's staffing needs even as far as 90 days into the future. And then finally, we have a superior education delivery program in the Center for the Advancement of Healthcare Professionals.
Now, prior to becoming the Chief Clinical Officer for AMN Healthcare, you were involved in something quite different, were you not?
Well, I was, Neal. I started my career in critical care nursing and spent about 5 years at the bedside. My specialty was really the cardiac side and not the surgical side, but an area that I truly loved and being close to the patients. I moved into nurse recruitment after that and spent several years with a large healthcare system in Southern California in the recruitment aspect. And really it was through that role that I met the then owners of AMN Healthcare. It was American Mobile Nurses at that particular point in time, a very small travel nurse company. And I made the move to join that organization as the VP of nursing at that time and have really grown my career in developing the roles needed as an organization grows from a very small company to AMN is now publicly traded, and we have more than 8,000 clinicians on assignment. My responsibility with the organization is to assure the quality of every single one of those clinicians and make sure that they are credentialed completely and qualified to work in the position in which we place them.
Now, you mentioned that AMN started out as a small staffing agency, basically traveling nurses.
That's right.
Now that you've grown to such a prominent stature, you're focusing on the quality of your product, the folks that you're sending out into the workforce. How does AMN balance quality staffing with quality education of your clients so that the people that you send are put in positions where they're not going to be considering retirement until they're 54 or older?
Right. So in the nursing space, and understand too, AMN does more than nursing now. We also place allied health professionals, advanced practice nurses, and physicians. But when I look at the nursing space only, the people that are applying and working through AMN are actually much younger than the average age of nurses. So the average age of nurses right now, well, over half of nurses are 50 right now. Our average age at AMN is running a little more around 36 to 37. So they typically have 5 or 10 years of experience under their belt, so they're well-experienced people, and they're moving into temporary, usually 3-month contract positions at healthcare organizations across the country. So those nurses are not among those that are likely to retire. In fact, they probably have moved into travel nursing because of one of the 5 dissatisfaction reasons, inadequate pay, short staffing, difficulties with the leadership, and those sorts of things are really the dissatisfiers that nurses see. They may have moved into travel nursing to get away from some of those aspects and experience something different, likely not to retire. But where it helps our clients is that those nurses may, if they find that workplace very positive and one that they think they're going to like, many of those nurses stay on with those clients in a regular full-time position after they finish their assignment with us.
Is AMN in the practice of offering some type of transitional position to someone that is considering retirement, a program of nurses educating nurses within AMN?
That falls within our Center for the Advancement of Healthcare Professionals, and that is where we will work with our clients to customize a program particular to their needs. When you talk to organizations across the country, the problems and issues they're having are different. So a one-size solution is just not going to fit everyone. And so we will work with our clients so that we may bring in additional nurses to educate them in certain areas, or they may be nurses that we just move from one area of the organization to the other. But the big focus that we have right now, Neal, is getting our clients to understand the nurses that are retiring so that we can help them fill that gap as those nurses start to leave.
Are you involved in educating or, offering advice to upper management as they receive these new people in the workforce? They're not just going to receive these new folks and have no idea what the mindset of today's nurse is.
No, absolutely not. In our programs, we really look to making sure that that education program is tailored to the client, but there's certain key things that we think are very important. Teaching nurses how to develop trusting relationships with patients so that the satisfaction and engagement of patients will be higher is really, really important. So those are things that we can deliver to our clients as well. And we produce these programs really to help our clients get into an area where they can sustain the program continuing so that they're not always going to have to call on AMN to help. Now they've got a sustainable program that will help them deliver, whether it, as an example, 15 operating room nurses every year or every 6 months for the next 3 years to be able to replace those retiring nurses that are going to be giving their notices.
As a huge healthcare provider, being involved in continuing education and quality relationship with your clients, as these nurses are seeking employment, how much are you involved in sending specialized nurses? Is that something that's pretty much par for the course, or are you more involved in nurses that are trained and knowledgeable in more general nursing?
Now, nurses in general are trained across the spectrum, and in the survey the survey report that we developed, we kind of show the responses related to each particular specialty. So all of the nurses across the country are kind of focused in these different specialties. 65% of them are working in hospitals. Only 1% of those are travel nurses. But the travel nurses that we're providing go cut across all specialties as well. So your cardiovascular ICU nurses, your neonatal intensive care nurses, labor and delivery, AMN is able to supply all of those.
Do you see a surge for the future in a particular specialty that's going to be in the highest demand?
The critical care areas have been in the highest demand for several years. This year we're seeing, and I think it's more related to the Affordable Care Act, but really a surge in emergency room needs, and that goes for both nurses and physicians. The emergency departments have been basically exploding. Since I think the ACA implemented the insurance programs, is now, 14, 15 million more people have access to insurance and access to care that didn't before, and actually that care now is reimbursable to a hospital. So kind of pluses on both sides there. But we definitely see the critical care areas that will continue to grow. Hospitals are becoming more and more places to manage the critically ill, as opposed to, and then the outpatient setting in the home is really where we'll be managing those that are acutely ill. So I see nothing but the critical specialties continuing to grow.
And let our listeners know where they can get more information about AMN Healthcare.
Sure, absolutely, Neal. The website is www.amnhealthcare.com, and our 2015 survey of registered nurses is available online at that site.
You've been listening to Health Professional Radio. I'm your host, Neal Howard. In studio today, talking with Marcia Faller, PhD, RN, and CCO for AMN Healthcare. We've been here talking about AMN and about the coming surge of nurses who are going to be leaving our workforce. It's been great having you here with us today, Dr. Faller.
Thank you for having me, Neal.
Thank you so much. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to our podcast on iTunes.